Talofa lava, mālole soifua malalangi mama, o lo uingoa o Harriet Paunga, o au le Regional Director for the Northern Region in Pacific Health New Zealand. I led the Health New Zealand nursing team that responded to assist in the outbreak in Samoa. And through my 20 years of nursing, I have never seen anything like it. My team was made up of dedicated and experienced nurses. Some served in the Matuotua Hospital in the acute areas where David's story that you will hear later comes in. Many of my team had connection and ainga to Samoa. We provided language and cultural support as well as nursing support to a health system that was stretched by this outbreak. Also, some of my team did not have connections to Samoa. But as per the Samoan proverb, o lupe sa vau ese ese, ai ua fui fui whatasi, meaning we are from different parts of the forest, but connected in one cause. David's story you're about to hear is the story of that service. Mā lo le tautua.
The 2019 Samoan measles outbreak began in September. By January 2020, over 5,700 cases of measles and 83 deaths, mostly children, had been reported. The local Samoan health professionals were overwhelmed by the scale of the measles epidemic. In ICU, the nurses had not been able to leave. Some of them had slept there for up to 2 weeks. The local intensive care nurses had done an extraordinary job making things work, keeping things going, but the point that we arrived at was near the end of their capacity to be able to provide that care under such pressure. I responded to a request from the New Zealand nursing organisation College of Critical Care Nurses, who asked for volunteers to go to Apia, Samoa to support the ICU nurses. So I went as a volunteer and I worked as a critical care nurse for 7 12-hour shifts over 7 days. Most of our patients were children, most of them were under 18 months old. Pretty much all of them were babies. All of the patients that we were seeing had measles and complications of measles. I arrived near the peak of the epidemic and resources were severely strained. There were no spare beds and personnel and equipment were severely depleted. On the equipment front, I recall manually ventilating a baby with a bag valve mask because there were no ventilators left to put the child on. Around about that time, an international medical logistics company arrived with 4 brand new ventilators. I quickly had no choice but to put the child onto one of these ventilators. This was just something that needed to be done under the circumstances. In that time period, 6 children died. It had been the same the week before and it was the same the week after. It was near the peak of the worst of the epidemic. Despite knowing we helped so many children survive, witnessing so many children die in such a short space of time was overwhelming. And it's a memory that stays with me today. As part of my role as a registered nurse, I also work as a core instructor teaching other health professionals advanced life support. During that training, we work on how to resuscitate babies, and part of the technique of doing CPR on a baby is that you need to encircle their chest and use your thumbs to provide compressions. I find when I do this, it takes me back to Apia, makes me feel uncomfortable for a moment as I remember this tragedy that unfolded in front of me. During the epidemic, the herd immunity of the Samoan community was very low, with extremely low rates of immunisation. What this meant is the most vulnerable, especially children, particularly under 6 weeks old before they could be immunised, were particularly harder hit. This was really challenging to see, given that the measles is an immune preventable disease. While we were there, we asked the locals about why immunisation rates had been so low, and they told us stories about the spread of misinformation, where stories had been circulated around where people had really adverse effects from receiving immunisations, and that this had caused a lot of the local population then to distrust immunisations, and had meant that herd immunity had lowered, and we'd got to this point that we're at now where there was a disaster happening. Despite the exhausting experience of working there, at night when I was trying to rest, or in the day if I was on night shift, I'd still be looking at social media, particularly the coverage of the epidemic, and it was extremely distressing to see that there were still commenters out there making false claims that the children that were dying weren't dying of measles related illness and were dying of maybe a bacterial pneumonia, which of course wasn't completely untrue, but the bacterial pneumonia was secondary to the measles infection, and the truth of the matter is that those children never would have got it if they had never got measles in the first place. After I got home, it was quite an intense period, even though it was relatively short, but I did manage to maintain some links back in and find out what happened to some of the patients who I had been involved with when I was there. And I was really pleased to find out that they had survived and done well, and they'll now be little kids running around doing what they should. It's a very satisfying feeling. I feel very proud that I was able to bring that to help from New Zealand, and I'm also very proud of our other New Zealand nurses that came and supported this tragedy at this time. I think what's also important about this is the courage and bravery of the Samoan health professionals who went above and beyond, and they never gave up. They never gave up, and it was a privilege to support them and give something from New Zealand in this time of need. This story is the worst case scenario. This is what happens when measles gets out of control in our communities. This could happen here in New Zealand. My message is simple. Please immunise your tamariki, protect them, stop this from happening here. Many years of clinical research and tests have shown that the measles vaccine is a safe vaccine, and this story is an example of why we need to immunise our children.